Good evening, everyone. Today is 1st July. We are celebrating National Doctors' Day in the memory of great Dr. Bidhan Chandra Roy. Indian Pharmacological Society West Bengal Chapter and Inovocare Academy, we are today observing National Doctors' Day by re-emphasizing how to improve doctor-patient relationship. And on this event, we have multiple dignitaries. They will speak on how to improve doctor-patient relationship. Also, personally, I have one PowerPoint presentation today on this topic of doctor-patient relationship. So let's start our program with blessings from Professor Apurba Kumar Mukherjee, who is a very well-known figure in the field of medicine all over India. He is Professor of Professors. Let's hear from Professor Apurba Kumar Mukherjee.
Good afternoon, everybody. Good afternoon, my friends, colleagues, and the people around everywhere in Bengal and maybe spread in different parts of my beloved country, India. Today is the Doctor's Day. I want to pass on this message for the doctor-patient relationship improvement, which is a very burning issue to the practitioners at different corners of this huge country. But it is very important for all of us, the caregivers, to introspect themselves so that they can improve their services to the mankind. They have to take into account about the different aspects of the socio-economic status, educational status of the individuals spread all over this huge, beautiful, diverse country. And we, the doctors, must elevate ourselves so that everybody coming to us must go back satisfied, at least in his mind, so that we counsel them. And counseling is an important art, and it has to be learned from our teachers. I used to learn counseling from my golden teachers who didn't teach us only medicine, but also they dealt with so many deep, important nuances of the human mind when they are suffering from some diseases. The patient's family members should also be taken into account while they cry and they starve for nights together for the improvement of their ailing personnel in their family. So we must not be only at the technological hands. We must be guided by our spirit. We, the doctors, must not use the term doctor before our name, only as a prefix. It should come with a responsibility. It definitely comes with a power, but this has to be executed on a daily basis, on welfare of mankind in a broad sense. And we also try to educate our patients and their family members to elevate themselves from the different interferences, particularly bad interferences, the political interferences, the interferences of hooliganism, which hurts the doctors and thereby physical hardening and physical assaulting, abusive languages to doctors in their office, in their workplace is absolutely unwelcome. We must join hands together so that our patients, their family members and doctors all can elevate themselves to improve our relationship with a significant level to outcome benefits to the majority of sufferers. Thank you all.
Now, let's learn from Professor Nilanjan Sengupta, who is an noted endocrinologist in our country. He is famous in the field of endocrinology and also he had a huge experience in practicing endocrinology. So we are really fortunate to have him. Let's learn from Professor Nilanjan Sengupta, who is currently Professor and Head at Department of Endocrinology at NRS Medical College, Kolkata. How to improve doctor-patient relationship.
This is Dr. Nilanjan Sengupta, Professor and Head, Department of Endocrinology, NRS Medical College, Kolkata. Today, I would be telling you a little bit about doctor-patient relationship. Over the years, there has been an alarming degeneration in the doctor-patient relationship in India, with incidences of doctors being attacked, abused, threatened by patients and patient parties coming to the fore. Now, for this unwanted scenario, who are to blame? I think everybody concerned is to blame. The patients, the society at large, and probably also the doctors. We as doctors only can change ourselves or behave properly so that such incidences can be minimized. First, I would suggest we as doctors should respect our patients as human beings. We should give every patient, irrespective of caste, creed, religion, social status, economic status, the dignity of a human being. Second, we all should be true professionals. That doesn't mean that we won't be charging fees from our patients. When it is due, we would definitely charge. But when it comes to rendering services, our approach and attitude should be absolutely professional. We should explain the patient what we can deliver to them in a current situation, and also explain what we cannot deliver. Because you have to understand, as doctors, we are human beings. We are not God. We may not be able to cure all patients all the time. This has to be explained to the patient and the patient party in our interactions. Therefore, we should be truthful to our patients. Truthful not only when it comes to expenditure of treatment, but also to the course of treatment, duration of hospital stay, and the prognosis. Today is the era of patient-centric management and shared decision-making. That is, the patient or his or her close relative should be made a party into his or her treatment decision-making. That means we have to respect the patient's wishes when we offer some treatment to the patient. That also means we should not allow to be dictated by the patients. We should be firm and scientific on our approach to treating a disease condition, but at the same time, giving cognizance to the patient's wishes, more so in situations where more than one therapy exists. Lastly, one should not criticize one's professional colleague in front of the patients. Above all, we as doctors need to keep ourselves updated in the developments that occur or that are occurring in the field of medical science, especially the area where one is practicing. Because if you are not scientifically sound and scientifically updated, you will lack in confidence, and that lack of confidence would be manifest while dealing with your patients. Lastly, we have to realize the fact, just as patients cannot do without doctors, doctors also cease to exist if the patients do not seek their opinion. So it is an age-old mutual symbiotic relationship that is going to stay only through certain good approaches, certain rational behaviors, we can improve the doctor-patient relationship. Let's all have a very fruitful relationship with our patients. True, we would not be able to cure all patients, but we can always create a lasting impression in the minds of our patients and patients' parties as a doctor who tried, as a doctor who is sincere, as a doctor who is honest. Jai Hind.
May I request Swami Kripakarananda Maharaj ji, who is also an excellent doctor, now providing his service at Ramkrishna Mission at Arunachal Pradesh. Maharaj ji, please guide us regarding how to improve doctor-patient relationship.
Namaskar. Ko nu sat upayatro yenaham sarvadehina antah pravishya satatam bhaveyam dukkha bharabhak. An ancient prayer of a pure person of pure heart who wants to alleviate the pain of others. If he cannot do by physical means, he wants to enter the heart and get the pain of the suffering person. This was the prompting force of becoming a doctor. That's why it is said a noble profession, because until and unless we are having sufficient noble impetus, we cannot pursue the medical profession, because it is completely separate from other profession. It's pure in its purpose, and the medical thing is as ancient as creation and as pure as creation, as honest as creation, because this suffering is always there and removal of the suffering is always there, and it deals with the human being, the whole divine being. So unlike other professions, it is full of responsibilities, and we have to come in contact with patients. We call now patients or rogi, and we treat them, and we have to earn from them, from this profession. So far so good, but the point is, when we lose our purpose, it becomes vicious and it becomes very prominent in the world of corruption. Unlike other professions, the prominence is more because the expectation of becoming noble is very high in this profession. As Swami Vivekananda puts it in a very nice way, that Shivagyana Jiva Seva, he used to call this not rogis, he used to call rogi Narayanas. If we have this attitudinal correction to correct the patient along with the medical things, surgical things, mental things, we also give our heart, give our empathy and sympathy. That cures much more, that actually removes the pain and the feeling of the pain and gives a lot of satisfaction to the patient. It is as well as good for the doctor to become high in spiritual life, and also it is very good for the patient. And that is the real Indian ethos of doctor-patient relationship. And by that correction of this attitude, we can evolve to become wonderful.
We are really privileged to have today Professor Jyotirmoy Pal, who is Dean-elect of Indian College of Physicians. He is also a very well-known figure in the field of internal medicine all over India and prolific practitioner at West Bengal. Sir, let us know your views on how to improve doctor-patient relationship.
Doctor-patient relationship is an auspicious relationship. if you go through the stories of the Puran, there is the one story. Yudhishthir was asked by the Dharma that who is the greatest friend in the universe? The Yudhishthir replied, it is a physician who is the greatest friend in universe. So this was a relation of doctor and patient in ancient time. In the period of Vedas, doctors were considered as a god, Dhanvantari. Then the scenario changed gradually. In the Greek and Roman period, doctors was considered as a mentor, is a philosopher. Then the situation again changed. In the medieval period, doctor was considered a service provider. Then the Renaissance came, man's attitude changed. Then the doctors was considered a mere service provider with a scientific knowledge. And now, in the era of 21st century, doctors is simple a service provider and relation is like a consumers. So the doctor-patient relationship has changed from time to time. But one point to remember, still I believe it is a very auspicious relation. And if when a patient came, whatever may be the controversy, whatever may be the criticism lies, doctor always consider his patient is a god, and a doctor, he should consider his patient is the most valuable asset to him, and he should think about his or her health only, his benefit, not the benefit of any other means. In this way, doctor-patient relation can grow like anything. Thank you.
We are really fortunate to have today with us a noted clinical pharmacologist in our country, Professor Santanu Kumar Tripathi, who will speak on again this very important topic, how to improve doctor-patient relationship. We know Professor Santanu Kumar Tripathi was professor and head at Department of Clinical and Experimental Pharmacology at School of Tropical Medicine, Kolkata. And he is associated with multiple clinical research. He had a huge experience on clinical research. Let's learn from him how to improve doctor-patient relationship.
Good evening, everybody. Today, I have been asked to say a couple of words about doctor-patient relationships. We all involved with healthcare delivery, we appreciate how important this relation is. The success of any medical consultation or intervention depends much on a very sound doctor-patient relationship, and it's a relation which is based on mutual trust. It has been very unfortunate in recent times, in fact, for a few decades now, throughout the world, and India is no exception, that we have seen a real, we can say, decay in such relationship. And for diverse reasons, this relationship has now hit its bottom, we can say. Both sides, the doctors as well as the patients, have developed an unduly negative bias about each other, and it itself runs the risk of further worsening the relationship. And that's what is happening every day now. If this dismal situation really worries us as the medical fraternity members, it is us who have to perhaps do something different in order to reverse the situation for the better. If we cannot change them, the patients or the community or the society at large directly, then why not try to do something to mend ourselves with some back to basics mantra and see how this can really impact on them as a community. Let me submit with these, with a set of you can say code of conduct for ourselves, that we believe if we sincerely practice them, consciously practice them, this can possibly change the situation for the better. Now, what are these code of conduct? The first rule, and this is nothing very new that I am going to really tell you of. The first thing is to attend them when the patients are approaching us, to attend them most appropriately. And for that, I would say that first thing is, if it is a clinic or outpatients consultation, then we must ensure that we do not unduly make them wait for long hours. Because after waiting for such long hours, when they meet us, the patient is already have developed a negative bias towards us. Second is about when we, for the first time they see us, we need to really greet the patient with a smile. And we must establish an eye contact. And then we must try to know the person, talk to the person. Like in bank, we say that the bank try to know your customer, KYC. Similarly, I would say here, KYP, know your patient. Every doctor should try to know his patient at the very outset. So because it's the patient's context or the patient's background which will actually guide me as a doctor to decide what kind of treatment I should prescribe, so that this is most acceptable by the patient and the patient can afford that treatment, etc. So talking to know your patient, talk to KYP. Next, I would say the next opportunity to bridge the gap between me as a doctor and the patient who has come to me is listening to the patient. And when I say listen with expressed attention. That means when the patient is trying to express himself, tell me his story, then I should keep my eyes on his eyes and try to listen to, and to not just listen, but to make the patient understand and appreciate that I am listening. Third thing I would say about communication, communicate effectively. When I say communicate effectively, I mean this is the opportunity when I start communicating, I should be able to empathize. I should speak softly, but with confidence. I should always be positive. I should be honest and truthful. There is no scope or no room for any falsehood. I would not give him any kind of impossible kind of expectations to develop in the patient. Rather, if there is some fanciful expectations in the patient, I should try to remove them at the beginning itself. At the same time, I would accept my limitations if the situation is such, and I should refer the patient. So proper referral is also, in a great extent, would prevent any kind of future hassle. Referring a patient to an appropriate expert. And I must be respectful to other physicians and should never ever try to criticize a physician in front of a patient. Next comes documentation. So this is extremely important, proper documentation, legible documentation, and in the real time. And many a times in today's time, this documentation, good quality documentation would otherwise, has a huge medical legal value also. And finally, we have to think of examining the patient. That is also a must for all patients. I must examine before coming to a diagnosis, provisional or final. And that examination, when I do, it must be done in the most respectful and dignified manner. I must respect the privacy and dignity of the patient while examining the patient. We must remember the patient has submitted to me fully, and confided with me all his personal information and private information. I should respect that. Next comes almost what we say that almost synonymous to the outcome of any medical consultation is writing a prescription. We must see, if we consider this as the act, the final act is writing a prescription, I must do that, I must act responsibly. The prescription or my prescribing must suit the index patient. I must explain the details of whatever I have prescribed with emphasis on the chances or probability of adherence by the patient. The success of any consultation depends on adherence, patient adherence. So from the beginning, I must be careful about that and identify the factors that might affect or adversely affect the adherence and try to guard them against. Next is, I should be always be with the patient. That means being with the patient means following them up, continuously monitoring the patient. I should identify the strategies and mechanisms so that I can maintain a contact with the patient until the patient gets all right, so far as the problem for which the patient had come to me. I must keep all communication channel open always and follow up the patient regularly. Next, I would mention about trying to maintain the calm and compose in difficult times. And particularly, this is very pertinent in currently the trend that we have seen, the undue unrest by the patients and their kin. And many a times the doctors, they feel very helpless. Now, maintaining a calm and compose is extremely, extremely important to handle the difficult and trying times. The other important issue is a good doctor will also have a necessary skill of getting detached. That is what is called quality of detachment. We must be able to demonstrate dignified detachment in successes or in failures. So I should not be overwhelmed when I succeed in a given endeavor, or neither I should be extremely dejected and express that overtly in front of the patient if there is a failure or if there is a mishap or if there is a death of a patient, etc. And finally, if I follow these ground rules, then probably I should be able to set an example to the patients as well as to my peers, to my other colleagues. And this little bit of endeavor from my side or attempt from my side, conscious attempt from my side, I believe will go a long way in reversing this dismal situation and continuous trend of erosion of doctor-patient relationship and erosion of the mutual trust. We all hope that this situation is going to be better in the coming times, but then all of us have to put our own effort. And I believe that the members of the medical fraternity, it is ultimately their responsibility. And I strongly believe that if we consciously try this, we should be able to change the situation for the better. Thank you very much.
Good evening, everyone. So today we are going to discuss on doctor-patient relationship. So let's start our journey with few common quotes. First of all, from the patient side, the doctor did not even look at me before writing out a prescription. Number two, from the doctor's side, the patient's relatives threatened me about the consequences if she does not recover. From the patient side, again, the doctor was very critical and judgmental about me. The doctor cannot even guarantee that my wife will recover with his treatment. So this type of quotes are very common. And when we are talking about doctor-patient relationship, one of the most prominent issues is paternalism versus patient's autonomy. That means physician's authority versus patient's choice. And when we talk about doctor-patient relationship models, there are four very important models described by clinical researchers. Number one, the paternalistic model, where doctor decides for patients. So here, doctor acts as a patient guardian. And we commonly found this in our Indian context, where patients feel that doctor is the guardian. Next model is informative model. In the paternalistic model, the autonomy of the patient is hugely compromised. Next, when we are talking about informative model, there is a fullest autonomy from the patient side. And here the doctor only provides facts to the patient. Patient has total autonomy to choose the intervention that suits their values and affordability. The third model, that is known as interpretive model, where doctor helps patients to find their preferences. So patient is vague about their expectations here. So doctor can act as a mentor here. And when we are talking about the deliberative model, here doctor in addition also tells his own preferences. So there is a process of shared decision making with mutual participation and respect. Here, not only doctor acts as a mentor, also acts as a friend also, just to let patient know about his own preferences. And that should be scientifically. So another model is there too, also known as instrumental model. Here the patient has no freedom and patient values are irrelevant. Specifically, doctor aims for a goal here unrelated to the patient, like the good of society or advancement of the scientific knowledge. But this advancement of scientific knowledge, I here want to strongly object, because all clinical research specifically done today is not, there should not be any place of this type of model. So this model has undergone moral condemnation, applicable only when patient is a direct or intentional threat to public health. Just like if a notifiable disease patient is not listening to doctor, it is a duty of doctor to notify proper authority. So when we are talking about this doctor-patient relationship, there is no doubt in that it is a special relationship. And this type of special relationship requires philosophical, sociological, and literary attention. And this relationship starts with medical interview. And when we are talking about medical interview, that should have three important components. Number one, it should determine, monitor the nature of the problem, then develop, maintain, and conclude the therapeutic relationship, carry out patient education and implementation of the treatment plan. So there should be a dynamicity in this model. And when we are talking about this medical interview, we should give emphasis on following points. First of all, preparation of the environment is very critical, because everything, why we are doing this? Because this relationship, therapeutic relationship, requires improvement in biological, psychological quality of life, compliance or adherence to the treatment, and ultimately the satisfaction from the patient side. So this is the ultimate goal of any good therapeutic relationship, to have a good quality of life, better compliance, and better satisfaction, so that we can increase the efficiency of this therapeutic relationship. And for that, what we need, the medical interview should be done, or medical examination and treatment should be done in a proper environment. We need to prepare ourselves before interviewing, before having talk with the patient. We need to observe the patient, and we start the conversation with a grit to the patient. Next, when we are beginning the interview, then we should detect, and also we need to find a way to overcome barrier of communication. We should have a good list of survey problems specific to those patients. Then we need to negotiate the priorities, and also what is very important, that this clinical expertise, what we talk about, what we taught from our medical school, that is associated with the ability to manage the uncertainty of the query. So we need to be prepared about those queries from the patient side. And then we need to have a narrative thread development, establishment of life context of the patient, then safety net establishment is very critical, and presenting the findings and what are the options patient could have, we need to tell, we need to express. Negotiation on the plans as per the patient's need, patient's affordability, access, we need to check. And finally, we should have a closing of the interview. And here also we need to give emphasis that sometimes this dissatisfaction often occur when the patient goes out from the clinic. Again, some patients will come back, same patients will come back to ask something. So there is one clinical research that was conducted on patient satisfaction. It was found that almost 10 to 20% dissatisfaction happen due to some behavioral changes from the physician's part when the repetitive entry of the patients after exit. So there could be a possibility of the re-entrance of the same patient with some specific queries. So we need to also address those queries carefully. So what is very important, why these things we need to give emphasis, because discontinuity of the treatment is also noted as discontinuity of the doctor-patient relationship. So there are many instances due to bad communication and poor doctor-patient relationship, many patients stop taking modern medicine, and that leads to different types of complications. And I think we all had faced this type of cases in our lifetime. And when we are talking about the doctor-patient relationship, it is something which continued over time, and it actually allows doctors to build the puzzle for the patient. And this puzzle of patient care need to be dealt with softly and need to use some important psychological context, and using these 4 points, which is very important to build a proper doctor-patient relationship. Number one, we need to know a large amount of biopsychosocial data of those patients and its context in a way that facilitates successive diagnosis and treatments. Number two, the form taken by the doctor-patient relationship in itself provides valuable information to interpret the reason for consultation. The doctor-patient relationship itself is therapeutic. So we often face this type of thing when we have a good doctor-patient relationship. that actually aids patient to get benefit from the treatment. The doctor-patient relationship is one of the main factor that influences compliance with treatment. So these all are the study reports we found, and we all should give emphasis and acknowledge that effective use of medical interview, the most important part is patient had been heard and allowed to express their major concerns. This is the most important part. We need to allow patient to express feelings and expectations. There should be respect and empathy, positive regard, congruence and understanding, and caring and self-disclosure. So these all are the key areas. And when we are talking about doctor-patient relationship, the trust is the most realistic relationship, has history of reliability, advocacy, beneficence, and goodwill. So number one, the perception of patient that they are the focus of the time. That is most important. Whereas the actual time spent is less critical. So we need to give good emphasis, or we need to give emphasis on how to build the perception of the patient that they are the focus of the time. Eliciting patient's own explanation about illness. Again, that is very important. Patients were accurately heard and adequately informed. So information should be properly percolated. And also we need to involve them in their own treatment plan. So these all are important to build trust, and which is the essence of building this relationship. And when we are talking about doctor-patient relationship, another important factors we often miss, that is organizational factor. So where the doctor is practicing, the hospital environment, so everything is very critical. So organizational factors need to be given emphasis, and it was shown that many questions, many comments from the organizational staffs is critical in destroying this trust, destroying this doctor-patient relationship. Like if someone is commenting from the organization, whose doctor is it? So this type of question, this type of comment is very critical. They destroy doctor-patient relationship. The other factors like accessibility of clinical and administrative personnel, specifically when they are waiting, just like the nursing staffs, the administrative personnel, how they are communicating. There should be a reasonable waiting time, attention to personal comfort for the patient, some reminders, some good educational materials that create some good atmosphere of caring and concern. And also, what is very important to note, there is a tendency of combining exaggerated promises and efforts to deliver less. So there is a competition of patient enrollment, and that ultimately leads to this type of false promises. So we need to give emphasis not to have this type of things, because again we need to ensure that organizational factors should not break this type of trust, because in this dynamicity of doctor-patient relationship, we need to acknowledge trust is a fragile state. And when we are talking about information, we need to give emphasis on evidence-based medicine. And we all know the definition of evidence-based medicine. Evidence-based medicine is defined as the conscientious, explicit, judicious, and reasonable use of modern best evidence in making decisions about the care of individual patients. Evidence-based medicine integrates clinical experience and patient values with best available research information. So there is 3 pillars of evidence-based medicine. So 3 pillars means, number 1, the available evidences. Number 2, the expert opinion or the clinician's opinion, treating physician's opinion. But number 3 pillar is also very important, the patient side, patient values. So we need to have very clear-cut practice on this evidence-based medicine when we are talking with our patients, when we are informing our patient. And that is why, what are the 4 important pillars to build this doctor-patient relationship? Number 1, the essence of doctoring. So here, the essence of doctoring means we need to combine the knowledge, understanding, teaching, and finally the action. So teaching is very important as we are talking about education, because we need to educate our patient about the advantages and disadvantages, cost and benefit analysis, and what we are going to tell our patient, that is more critical. And that is why what is doctor means. Doctor, that words comes from a word, Latin word, docere. That means to teach. So teaching is a very important part of our doctoring. And that teaching means we need to impart a good evidence-based knowledge to our patient. Next, the caring doctor is again very important concept. Integration of patient's clinical condition and personal values makes a recommendation on the appropriate course of action. And finally, the clinical relationships. So that requires the same focus and attention as technical competence. So these all are very important, and what is very much we need to give emphasis that whatever we will do, that should be evidence-based practice. And when we are talking about promotion of patient-centered culture, so we need to pay attention to psychosocial aspect of care. We need to monitor satisfaction scores with visit times and other things, quality improvement and standardization. We need to encourage the accountability of our organizational sectors members, different support staffs, practice prudence in medical decision. The accuracy is very important. We all know that we are now moving towards an era of precision medicine. So we should give emphasis on this. We need to minimize the conflict of interest. Our organization where we are practicing, they should promote candor in advertisement, eliminate different type of intrusive incentives. We also need to promote fair contracts between organization and doctors. And also we should maintain the confidentiality of the patient. And what we need to emphasize that as this relationship is having a dynamic nature, we should avoid decisions that interrupt the continuity. So overall, we need to protect the interest and preferences of individuals. So as a whole, what is very important, as our ancestors told, Sarve bhavantu sukhina, Sarve santu niramaya, Sarve bhadrani pashvantu, ma kaschit dukkha bhagavavet. So may all be prosperous and happy. May all be free from illness. May all appreciate what is spiritually enlightening, and may no one suffer. So when we are talking about patient-centered culture, here also what we can see, this middle thing that is written here, you can find in the slides. So that is little bit tending or moves towards one side. And that side, when we are talking about this healthcare system, that is little bit tilted towards the most important pillar, that is the patient side. So we need to acknowledge in each step when we are treating our patient to build a good doctor-patient relationship. Now we try to finish our discussion, our presentation with one case from where we will get some take-home message, that a 18-year male type 1 diabetes with DKA presented at emergency of an hospital with a saturation of 78% 1 year back. His CBG was 564 milligram per DL. Now admitted in CCU, intubated. Central line was done in emergency by the treating physician. So as the patient was deteriorating, so management started. HSCT thorax suggestive of CORAD score was 4. Now COVID-19 RT-PCR reports came, which came to be positive. And yes, that report came after 3 days of admission. Now what happened? The patient's father had slapped that treating doctor, blaming the hospital is responsible for COVID-19 infection to this boy. So now you can assume this type of situation was very common and we often face. And this case was faced by one very good, dynamic endocrinologist of our city who does not want to reveal his name. So as we all know, our ancestors taught us, Dukheshvanudbigna mana, Shukheshu bigata spriha, Pitaraga bhaya krodha, Sthithadi muniruchyate. So one whose mind remains undisturbed amidst misery, who does not crave for pleasure, and who is free from attachment, fear, and anger, is called a sage of steady wisdom. And another sloka, again, Sri Krishna told, Yah sarvatrana visneha stvatra praptya subhashubham navi nandati na dvishti tasya pragya pratisthita. One who remains unattached under all conditions and is neither delighted by good fortune, not dejected by tribulation, he is a sage with perfect knowledge. And I think, yes, doctors are born to be, or what we can say in our society or our privileges like that, that doctor is need to be little bit, have this type of characteristics to be undisturbed by both misery and also the good fortune. And what happened ultimately in this case? The patient was discharged fine with his in a stable condition after 12 days. Now that father, the same father, was trying to catch the feet of that doctor, but doctor was moving away his feet and greeted with a simple namaste. So I think what is very important to note, that we need to be undisturbed with both good and bad comments from the patient. Yes, it is little bit difficult as a human being, but we need to practice this, because that practice could help us to prevent different atrocities. With that, I thank you for listening this presentation. Thank you. Finally, we have Professor Tapan Kumar Mondal, who is our President, Indian Pharmacological Society West Bengal Chapter President, Professor Tapan Kumar Mondal, sir. Sir, please let us know your concluding remarks on how to improve doctor-patient relationship.
Good relationship is essentially required in every sphere of life to maintain the peace and happiness in our family and also social life. So good relationship also should be there among the doctors and patient. Without this, the patient cannot be cured. Previously, it was told that the smiling face of a doctor will help to cure the disease about 50%. About 30 or 35 years back, there was the convention of family physician. So family physician, they are responsible to take care the health of the human beings in every day. So he was also responsible for doing surgery, doing gynecological problem, doing orthopedic, everything that was done by the family physician at that time. Now the thing has happened when there is the specialization in medical profession and then super specialization in medical profession. Say for example, in case of a cancer patient, the family physician will advise that the patient will not survive after 6 months or after 1 year. But nowadays, due to the super specialization in the field of your cancer therapy, the oncologist will advise, yes, you come to me and the patient will be cured after such and such operation. And the operation will be made successfully and it will be seen that the patient will survive instead of 6 months, 8 months. So ultimately there will be the death of the patient. But there is a huge expenditure of money from the patient party. So that creates a problem or some unfaithful on the doctors. So the thing is this, say house physician or family physician, what he is suggesting, and the oncologist, what he is doing, that is all right. But thing is this, in between this, that is the spending a lot of money. Then again the problem came.
I thank you all for being with us today on this August evening, and also request you your opinion, to put your opinion in the chat box regarding today's presentations, and let us know your views on how to improve doctor-patient relationship. Namaskar, Jai Hind.